to actually look today at the, according to what the papers are calling it, the outrage of the NMA and other concerned parties about the federal government inviting, a medical team in from China to assist with taking care of the patients. The NMA is outraged that it was not taking into consideration, it was not carried along before this decision was reached. It says that there are extant laws that federal government knows or ought to have known need to be addressed in, bringing in foreign doctors to take care of Nigerian patients. So while all of that is going on, there are also those that have issues of trust, perhaps. We shall be speaking with a public health expert. Everything depends on the presidential task force briefing that is going on right now. We'll see how, because we just need to be up to the minute on all of this. It's, we're in a very dire situation. Even as governments, state governments that is, are recording successes in terms of releasing, shall I say, discharging is the word they use in the medical world. Discharging some patients, they haven't recovered fully. The count still is not staying still. It is still going higher and higher. So there is that challenge. Then again, there is the whole attitude, no doubt, which is worrisome, of maybe the people's attitude to the whole stay-at-home order and maintain a safe distance. All this social distancing, arguably, it leaves a lot to be desired, the way we have been conducting it. Leaders around the world, our president, our leaders have, been telling us about this. But then we have the paradox in Nigeria of they are saying that, look, staying at home and doing the right thing is a challenge. What am I going to be able to eat? Really, at the very, very base level. That's what it is. This has led some governments to say, okay, we're going to, as it were, open up a window so people can do the needful, dash to the supermarket, no, not supermarket, dash to the market for necessaries, vegetables, maybe chemists, for, a few hours in the day. The worrisome part of all of this is the way we go about that. People are seeing that it just might, if we're not careful, be compromising the whole purpose and the whole reason for deciding that social distancing was indeed one of the main cures. Because, needless to say, most people that are watching me are able to understand it. But the fear is that a lot of people that are not able to watch, for one reason or the other, are the people that really need to be hearing it. And these, for different reasons. Some people who perhaps were not being too charitable have put this down to, in some cases, what they call spiritual arrogance. People saying that, nah, it just doesn't concern me. So it's like people are not getting how serious this is. Maybe they are lulled by the relatively fewer numbers that we are recording in Africa, including Nigeria. But we might say these numbers are few, but I've just been joined by my colleague Asukwa James. We're saying fewer numbers. Well, yeah, compared to the whole world, but those numbers are harrowing, they're depressing. I think we're in 300s, we're in the 300s now? In terms of confirmed cases?
No, we are not up to 300.
We're still 230 something.
234.
234 unfortunate deaths, and as you know, that's another topic altogether, because there are projections as to why our numbers are so low in Africa. I think I heard one such opinion over the weekend saying that, well, if we're lucky, it could well be that the tropical environment, by way of a miracle, and there is no certainty about it, just might be helping. Others are attributing it to, unkinder kind of reasons. But here we have it. And as Asukwa is joining me, we should be together. But as I said, ongoing right now is a press briefing by the Presidential Task Force on COVID-19 that we are waiting to join. And indeed, we have lined up also a public health expert, as well as a policy expert as well, strategic policy expert, to talk about this whole matter. Asuko, good morning.
Good morning.
You're very welcome.
Good morning.
It's not getting better. How worried do you think we need to be? Because President Trump was saying in faraway America that this was going to be a week of many deaths. He actually said as much.
Yes.
It's going to be a week of many deaths in faraway America. But in terms of infection, how far away is America? How far away is anywhere if we continue the habits that we seem to be engaging in right now?
Well, I think we should get worried, because if you look at the numbers, a week ago, it was about 109 or 111. So, and today, as we speak, is about 234, which means in 1 week, we've had 100 confirmed cases, in Nigeria, 100. And so that should get us worried in the sense that every week we should be thinking about 100 cases or more. So even if people are saying that, oh, it can't happen in Nigeria, it can't, because Nigeria is a tropical, environment, yes, and all that. And
there's
our
absolutely no scientific proof
there's no proof.
For such
there's
a
no proof.
theory.
Our attitudes, to this particular virus is even going to make it worse. Because when they are saying, why not sit down at home so that we deal with the confirmed cases, we can continue with the contact tracing and all, people are still going out, going into jogging, going to meet families, going to the market where even when they don't even need the essentials.
And even though the incidence has gone down, there were also reports of some religious functions going on, and people believing that faith, leaning on their faith. One knows all about faith, but it's troublesome. Maybe we need to get the message out there. Maybe everybody needs to be on deck. We have the governor of Lagos State leading from the front, as it is. I don't know. Maybe people just need to hear it from people they will take importantly. Maybe that's the point.
Yeah. Okay, take for instance what happened just yesterday before a popular actress that was, arrested by the police. This is something that could have been avoidable. She being an ambassador,
indeed,
in the whole matter.
Well, an ambassador. But I think they've removed her from that position.
Yeah, well, so we heard. But the thing is, if you are now looking at people who are supposed to pass the message to people so that people can, say, oh, this particular person is passing this kind of information,
Exactly.
Because even every day I wait for the governor to come up with something cherry, and it means that the governor is the one giving hope to many Lagosians right now.
Indeed.
Because the governor will always come out to say, okay, we've discharged this number of people, but before you know it in the evening, we hear some other cases are out. So people of influence
need to come out.
They need to really come out. I think I saw a pastor Ashimolo's, a short clip of him trying to dispel the rumor about the 5G having correlation with coronavirus. And I think, it came out all out to dispel that rumor. And also to tell people that it's a must that people must take their personal hygiene serious.
For one moment, please. As I said, we wanted to start from the very beginning, even before the official time of the program, with the Presidential Task Force on COVID-19 briefing. I think we can check and see if things are a bit better. Indeed, it looks like they are.
Economic interventions of the vulnerable groups, as well as efforts aimed at scaling up surveillance, testing, isolation, contact tracing, personal protection equipment for medical staff, disinfectants for medical facilities, risk communication, community engagement, and clinical management of the critically ill. The basket fund will also fund socio-economic measures such as cash transfers or food distribution to the vulnerable groups. The government of Nigeria appreciates the role of the United Nations is playing to rally partners to support our nation's effort to fight the pandemic. And the operationalization of the One COVID-19 Basket Fund will be of great help in complementing government's effort to coordinate mobilization and rapid deployment of assistance where it is needed the most. We wish at this juncture to register our appreciation to the Secretary General of the United Nations for commending our modest response to the pandemic and assure you that this will spur Nigeria to work harder. We have the will, we have the people, the tools, and now we have the financing structure. It is now my singular honor and privilege to launch the One COVID-19 Basket Fund to the glory of God and to the best use of humanity. I thank you for listening. Thank you.
Thank you very much, Chairman of the Presidential Task Force and Secretary to the Government of the Federation. That brings us to the end of this ceremony. As we step out from the entrance of the building, we will be able to take a photograph to record the statement. Thank you very much. We shall not take national anthem.
Okay, 1, 2, 3, go. Arise, O compatriots, Nigeria's own obey, to serve our fatherland with love and strength and faith. The labor of our heroes past shall never be in vain, to serve with heart and mind, one nation bound in freedom, peace and unity.
Thank you very much.
Okay, back to Lagos studios with Asukwo James. Well, the Presidential Task Force didn't want to take questions, so we didn't get as much as we would have liked out of that. But we continue with our quest for information, and that's why we're not going to let any scrap go, is why we felt we had to go there. You know, we had to go to them and take in whatever was coming in, and know that you'll be getting a fuller report and interpretation of these things as our bulletins continue through the day. Back to studio, and Asuko, as I was saying at the beginning, it's just that this kind of a thing, any briefing, no matter when it comes, will take precedence over whatever has been laid down before. And so I was saying that we were going to talk about the incident that has sort of annoyed the NMA, the Nigerian Medical Association. That is the federal government inviting a team of doctors. How many of them a team of, there were medical,
About
13, I believe.
from China?
Yes, from China. And there's been this outrage that, wait a minute, why would you do that without carrying us along? That's on the one hand, the officials, the NMA, and they were citing provisions about, you can't bring foreign doctors to come and deal with Nigerian patients, not without carrying us along. So we'll be finding out how the doctors themselves feel about this. I think I have heard an explanation that, look, these people are not coming to take charge, but they do have experience. And this is what the federal government was thinking when it brought them in to sort of, bring such experience to...
Tell me that we don't have experienced doctors.
Okay, exactly what the NMA is saying, that they have so many retired people on reserves, experts.
Uncle, do you know, even outside Nigeria, we have so many good Nigerian doctors outside doing exploits. And most of them don't even want to come. Why? Because of the poor health infrastructure that they have. And so they are doing well outside Nigeria. Most of them.
But this is an emergency.
Yes. And so if it's an emergency, if we take this the COVID-19 to be an emergency, that is why all hands has to be on deck. All hands in the sense that even there's the Medical Laboratory Association, they were also complaining. And now it is the Nigerian Medical Association complaining. Why don't we have faith in our own people? Why must we go to China? China that even started the virus. Why must we even go to China to bring them in? No. Let's have faith in our doctors. If the federal government is saying that they want to travel all the way to bring Chinese to come and begin to say, okay, this is how this virus started, then what happens? So it means that it's me sending my child to go and study something like biochemistry for many years is a waste. Because this is the time to even bring the students who are into microbiology, students who are doing housemanship, to come and learn.
But okay, indeed. But the issue might be that, look, in any field of endeavor, especially in science, those that have been there, done that, and even though I hear there's a comment by a member of the NMA saying that they are hardly out of the woods yet. But, well, NMA, Nigerian Medical Association, and the Nigerian Association of Resident Doctors are saying that it's an insult to local health workers' sacrifice and, knowledge and workmanship. Let's see if we can get better luck on the phones, because we also have on the phone, all other things being equal, Mr. Yemi Makwadirun. Mr. Makwadirun is a governance and strategy expert. Good morning, Mr. Makwadirun.
Good morning, Uncle Yori.
Oh, good morning, sir. Thank you for joining us.
Thank you for having me.
I'm not going to ask you the same question I asked Dr. Boyo, because he will probably have a particular perspective, him being one of them. But from the point of view of policy, how do you see it?
Well, something
Okay, it's going to be one of those days. It never rains, but it pours, It's going to be one of those days. We'll continue to work on that because, there will be people who will be aware that, look, the program just immediately before this, the phone lines were as clear as bell. The Skype was good.
I think it's a network issue or something.
So maybe these things happen. By the time it was coming to us, and maybe depending on the network that we are using. So we're going to continue, and we'll see if we can, we'll see what luck we have, either with the phone or with Skype, as the case may be. So as we were saying, there are those, I would have wanted to know what Mr. Makwadirun thinks of this whole situation from a national policy point of view, is it desirable or not to invite in experts, especially those who have gone through a situation that we are now working at, or you know, just what the thinking is, and also try to evaluate and know how to think about the Nigerian Medical Association and NAD, you know, not exactly resenting, but they're just thinking that we weren't treated with the professional courtesy and respect that we deserve. We have been on the front line here.
Exactly.
We have paid the supreme sacrifice. You know, we have paid the supreme price in some cases. So how can you do this?
I think the federal government needs to respect the Nigerian Medical Association. I mean, when I mean medical association, both the biochemists, the nurses, the doctors, everybody that is involved. Now, if you look at the death that happened in Louth, there were a couple of nurses that were infected, and they are now quarantined.
Yes.
You know. Same, there's another one that happened in Edo.
University of Benin Teaching Hospital.
Yes.
Oh, we'll come and talk a bit about that and hope the lines work so we can...
know, so if you look at those numbers,
yes,
those on the front line are our own doctors and nurses.
Indeed.
And now most of them are already on self-isolation.
And the irony is that...
So if you now want to bring... I still don't know why they want to bring Chinese medics into Nigeria.
Again,
because
as
I
soon
believe
as the line's clear, we'll get some insight into that, because in this case, you know, we often say among ourselves how we don't have enough qualified medical personnel.
Exactly.
They are doing a yeoman's job, but all of us agree that we don't have enough.
Yes.
So this is why one needs to understand what the pros and the cons are of bringing in these guys. Could it be an issue of trust, for example? Because I don't know. I think the producer was making the observation over the weekend that, look, quote-unquote, almighty America itself is taking help from the Chinese.
Yes.
I understand that medical supplies are supposed to be coming.
But it's medical supplies, not medical personnel. They are two different things.
Okay.
If it's supplies, it's different. If it's personnel, our personnel with the people that we have here. Yes, Nigerian doctors, because of the experience that we have down here, because sometimes we go to the hospital and then the only thing they want to do, the people don't because of the experience we have with our doctors, we don't want them to, we seem not to want to believe them, you know. I have also had a very, very terrible and tragic experience with them before, you know. But for this particular case, for this particular matter, I feel that we should give them the benefit of doubt.
Well, whereas I'm coming along with your support.
You know what, sir?
But when you say benefit of doubt, this is something that everybody is doubtful about. Nobody knows enough.
The thing is, how far has the federal government gone in trying to get professors who are virologists, professors who are microbiologists, professors who are going to come
all the related
everything that expertise is related to this particular virus and bring them into one particular room with social distancing, of course, you know, and then let them begin to work. I know that the Nigerian Institute of Medical Research, they are on it already, you know. So, and I know most of the doctors, most of the professors are into, but we need more people. Rather than saying that you want to go and import, Chinese medics.
We will find out, but my understanding, it might be faulty, was not that we're importing them in that sense.
Are they coming as volunteers?
Well, they will join us, but not on a permanent basis. I thought the whole essence,
not on permanent basis, but we are going to feed them. We are going to house them. And whatever they are going to, when they are going, are we not still going to give them, oh, thank you for coming? Okay,
let's see if we can get Dr. Boyo now. Let's try Dr. Boyo again. Hello, Dr. Boyo.
Hello, Mr. Yori. Good morning.
Fine. Yori will do fine. Thank you very much. What do you think about the NMA and the Association of Resident Doctors? You're one yourself. You're a doctor yourself. Not being comfortable, according to news reports, with the federal government inviting a medical team that has experience in coronavirus treatment to our shores to join our people. What do you think the issue is?
Yes, thank you very much for the thing is communication. The Nigerian government appears to always falter when it comes to communication. I say still the government did not take into cognizance the presence of doctors on the ground, communicating with them and letting them to know that this is what we intend to do. Explaining to the doctors at home while we need, in most cases when you work in a company, you have what they call the user department. You want to buy an equipment, you are the managing director, you discover the user department. We intend to buy this equipment. Do you need it? What kind of manufacturer, what kind of age should it be? And they tell you. Here we have the Minister of Health, who incidentally is a very top member of the station and has been the president, and announcing that 18 medical doctors and workers are coming in from China, which is right now is a problem with personnel. I know that it's difficult to just recruit some people to do some jobs, but there's some aspects of this job that involves nuclear medicine and things like that. But it's on the ground. To know why what they need, what value they fit. Now you add this for that, they have experience. China is China, they never give you this club, that's number one. They will never tell you the exact number of people that died. They won't even tell you that the COVID is still on in China. Now, the CDC of America is there. Within Nigeria here, you have foreign experts within the WHO, within the NCDC here. So if you want to bring in Chinese experts, one, are they certified to work in Nigeria? Because any doctor to practice in Nigeria, any nurse to practice in Nigeria, you need to be certified, licensed by the Medical and Dental Council of Nigeria, or the Nursing and Midwifery Council, or the Laboratory Medical Science. Yeah, is not in Nigeria. They have already looked at this in internet and everything on the ground advice us on how to move forward. Then finally, look at the fact that what we have on the ground really is not the need for expatriates. We have enough doctors who are unemployed, enough consultants who are unemployed, enough specialists in this country who are unemployed and are even looking for jobs. If we recruit them and use them, it will be better than going to bring in the Chinese now. If the Chinese have certain expertise that we don't have, very good. Let us know about it. Let them be certified by the Medical and Dental Council. If they are going to be given temporary licenses, let them get it. But let us know what they are coming to do and whether they are certified to do those things. And then communication barrier, cultural barrier, And I tell you, those who get to Nigeria, they will burst into tears. Because the problem we have is not just having a mainland hospital that can take care of coronavirus. Is that if the rubber hits the road, we need much more than that in this country. Are we ready? Is Lutz ready to take in 200 people today as I talk to you? Is the Lasut Hospital, Lagos State University ready? So we are putting the cart before the horse. Before you bring in people to inspect, to work with you, put everything on the ground. Get your doctors and nurses on the ground to even let you know what their needs are. And they can tell you that, look, okay, we need this and that. There are many specialists around that are Nigerians. There are Nigerians in Ghana, there are Nigerians in Cameroon, there are Nigerians in South Africa. There are Nigerian specialists that are ready to fly in on their own money to Nigeria to help us. There is no specialist that China has that we don't have within and outside Nigeria that Nigerians in the diaspora. So while I agree that we need help, we need to get to know who we are getting, who they are, who they possess, 2, what kind of experience they possess, then 3, are to practice in Nigeria. If they're not, then they can just through the internet, they can go online and see what you have on the ground, and then we appreciate every form of knowledge. Even we doctors being obtained, sending this bilateral of health. Every day we are bombarded with literature. So we are getting more and more educated every day about this. But whoever we here, there must be a need for this. The person must be adequately trained and certified by a medical and dental council. And then the doctors on the ground must be expecting the person to fill a void. There must be a void. The person.
Okay.
At the end of the day, you find that you come here and the doctors on the ground may not even work there. Language barrier, understanding. Yes, you want to.
Dr. Boyo, so what you just said, that if people are going to come, and that even if we're going to make allowance for the fact that this is, the idiom has been used frequently about us being in a war here, and in wartime, perhaps some processes are suspended. So all of those registrations, accreditation, taking for granted that those ones can even be fixed. You seem to be saying that you, for instance, cannot see what the void is, that these Chinese professionals, not all of them are doctors. We understand that there are some nurses. Not all of them are experts, as you were referring to, that they are not coming to fill a void. Such a void does not exist that they could fill, seems to be what you're saying, if I understood you correctly.
Yes, even if there's no void, even if they're not. Hello, am I on to you, sir?
Yes, you are. We can hear you.
Hello. Okay. Now, if there must be a void, what does it mean practicing medicine? They may be coming as experts in the area of even telling us add this and this together. Now, if they are not doctors and I just signed, even if they are doctors and are coming to assist us, let us know what they are coming to do. They may just be coming, like you said, to just look at what we have on the ground. But the Director General of the Center for Disease Control was in China a few weeks back. The WHO has representatives in this country. The American CDC, the British CDC, their system fits more into our system. They speak English. They understand us more than the Chinese. Now, if you say those who are overwhelmed, that's not good. Look at the track record of the things. And if they are coming and they want to just come and look at what we have on the ground and give us free things, we still have to validate even the masks. If you listen to what the minister said the other day, or this somebody from NAB, the masks from China, they are being validated, which is good. So we don't just take things like that. Now, they can come into this country, they can advise us, but they cannot treat patients. And we are going to treat patients with the universal language. Whatever they want to use is universal. They are in the New England Journal of Medicine, all kinds of journals have these things. And they send us they can read. I just they want to come and spend a week.
Okay.
Spend a week and train us. This is called training.
Okay.
They're not going to treat patients. Training.
I wonder.
Maybe the NMA can sit down and look at it. But like I said, let the Minister of Health and those in the authorities take doctors into confidence and discuss with doctors what the needs are. If it's training, let the doctors know they're coming for training and we get ready for the training.
Okay.
And training can come into this.
Okay. Now, I wonder if we still have Mr. Makwadinu on the line. Mr. Makwadinu, you were, hopefully you were hearing Dr. Boyo. The question I wanted to put to you is that he's told it to us from the position of the Medical Association and the extant laws, the regulations, and, we just needed to have been carried along. But from a point of view of policy, are there comments that you could make when a country such as ours now brings in, and I imagine this is official, this cannot be less than federal government, level. When the federal government is inviting in a medical team, what are the policy issues that occur to you? Because people will think that it's a good thing. They have the experience. They've been through it. Just give me your thoughts, please. Okay, we're waiting for Mr. Makwadinu. the lines are really doing us something dirty, so to speak. We'll continue to explore it, and indeed, we do want to hear from Mr. Makwadiro. As a matter of fact, as well as the rest of you, it might just be that the networks connecting Mr. Makwadiro and our good selves, maybe if you were to vary that a bit, but we still have Dr. Boyo with us, hopefully. Hopefully we have Dr. Boyo with us. But okay, as we were saying, well, you've heard Dr. Boyo explain it. Essentially, it goes along the lines that you were even, talking about before we got on to Dr. Boyo. And he has said that, where is the void? Did the federal government consult? Because if they'd consulted, then we'd know what precisely they were coming here to do. As I pointed out, from what we see in the news, it's not every last one of those professionals that are coming in that are research people, professors, teachers. But I wanted to find out from Mr. Makwadiro, and I think Dr. Oboyo has given us his impression, what the rationale for bringing them in, now that you've managed to annoy the Nigerian Medical Association and the Nigerian Association of Resident Doctors, who, by the way, this reminds me, the resident doctors took a hit, according to the news yesterday, at the University of Benin Teaching Hospital. Again, Nigerian patients not being truthful. We were talking about our attitudes to all of this and how seriously we take it. Not only did those patients allegedly that caused the whole fracas over in the University of Benin Teaching Hospital, not only did they deny, according to reports, allegedly deny their travel history, they then went into the general wards and came in contact with so many doctors and so many nurses and so many other professionals and patients. And now when one of them really deteriorated, then they were suspicious. They tested them again, and having earlier tested negative according to the reports, they now saw that these people are testing positive. This is a problem. Okay, we took an off route because we were trying to wait to get Mr. Makwadiro on the line. Good morning, Yemi. Are we together now?
Yes, we are.
Now I was assuming that you heard Dr. Boyo's comments. I wonder what you think as a policy expert, as a strategist, as a policy strategy expert. What do you think of what the issues are from your own perspective? Nigeria, the federal government, has invited these professionals in, no doubt, because they have experience, China being what it is. Wuhan is in China, and maybe they were going to be able to work with our people. Give me your perspective, please.
Well, thank you very much, Mr. Folari. I think the major challenge we have at the moment regarding the importation, so to speak, or invitation of China, of medics, from China to Nigeria over the COVID-19, is for me, it's like making a mole, a mountain out of a molehill. I want to imagine that we have refused or failed, to define what the terms of engagement are, and that is why there seems to be a form of, distancing by Nigerian medical experts, from that decision. I want to believe that just as it applies to every profession, just in the same way that a New York qualified lawyer cannot practice in Nigeria, by the same token, a China qualified medical doctor, even if he's a Nigerian, cannot practice in Nigeria until they fulfill some of those statutory requirements for professional practice in Nigeria. However, such professionals can be engaged, in advisory of capacity. I don't want to use consultancy because in medicine, consultancy means something else.
Well, Mr. Makwadiro, yes. to be particular, I'm just looking at one report here. It says the experts, the 18-man team of experts, it actually includes doctors, nurses, and other medical advisors. End of quote, whatever that means.
Yes, but that doesn't change the fact that, you know, people who qualify to practice medicine or allied professionals in other countries other than Nigeria, be it in the United States of America, be it in Britain, there are laid down requirements for them to be able to practice in Nigeria.
That's right.
And the reverse is the case for Nigerian qualified medical doctors. Every Nigerian medical doctor that leaves the shore of Nigeria, you know, to practice in the United States or Europe, you know, or Saudi Arabia, still has to enroll, you know, as a professional in those countries. Now, granted that we are in an emergency situation, and
okay,
some countries have likened this even to a war. I want us to give the benefit of the doubt, you know, to those who are in the commanding heights of the medical profession in Nigeria, or at least public health in Nigeria.
Mm-hmm.
I mean, the Director General of the NCDC, the Minister of Health, the Minister of State for Health, all of these are qualified medical doctors. They are not less qualified, you know, than the leadership of the NMA that is resisting this. And so I think the problem here is the problem of, you know, effective communication between those who are the policymakers in the public sector, talking about, you know, public health now, and then the professionals, the Nigerian professionals who are on ground. Otherwise, I do not think this Ulabalu is actually necessary, because at this point in time, everything that we need to do and that we have to do must be done to ensure that this pandemic, you know, is brought under control, and that a future resurgence of the pandemic, or, you know, in Nigeria, or the virus in Nigeria is averted. So I do not think we should foreclose getting help from those who already have experience rather than reinventing the wheel. But I am not also oblivious of the fact that there is a perception, general perception about the country China. You remember back in those days, every fake product is referred to as Chinese product. But it has since changed. And today, there is also this perception that, you know, the virus was deliberately created, you know, by the Chinese for some undisclosed, you know, expansionist reason. So we need to put all of this, factor all of this into consideration, and, you know, agree that the overriding public good, which is the well-being and welfare, you know, of Nigerians, override all of these sentimental considerations.
Thank you very much, Yemi, for bringing that particular aspect up. It's like it's an undercurrent, perhaps, that people are not speaking up, you know, quite plainly about, but it probably would be in there. Dr. Boyo, if you're still with us, okay, Dr. Boyo is gone, but we have Yemi. So we're also going to be taking calls. I want you to call in if you know, so you can contribute your experience. You know, the conspiracy theorists have really been fully at work right round the clock. Yemi, you know, explained, you know, spoke about it, that there's this whole thing that's in the background about the conspiracy theory. Only this morning I saw in the papers that the NCC has actually reacted to the whole notion that coronavirus and 5G are linked, and that it's going to be the death of all of us, and that the Nigerian government has taken how many billions of dollars was it to lay cables and put up the masts and all of that. Now, whoever is interested can go check out the report. NCC has actually spoken. So it goes back to what Yemi was talking about, this whole matter about how we show the intention of the Chinese. Now, is that a ludicrous idea? Is it one of those, I don't know what to say, but surely it's out there that why would the government be inviting the Chinese when a lot of people are suspicious of the Chinese? Now, how charitable that notion is. I'm not saying what I think is commonsensical. I'm saying the notion out there. So I don't know how the policy people figured it out, but Yemi did make the very excellent point that the Minister of Health, all these people are no less professional doctors and highly qualified doctors as well. And so if all of this was happening under their watch, they are not ignorant of the whole issue. And this is a war type of operation. So that is probably what Yemi was alluding to when he was saying that, are we not making a mountain out of a molehill here?
Well, I want to look at it from this perspective. I think...
One moment, please.
Okay.
Sorry, let me bring Ada in from Jos. Good morning, Ada.
Hello, good morning, Mr. Yuri.
Good morning, ma'am. Good morning.
Yes, Ada from Jos.
Okay.
Please, I must first of all commend our doctors and the entire health workers in Nigeria. They are doing very well in combating this COVID-19. Well, now, what I want to say is that have we exhausted using all our doctors on ground? What are the Chinese doctors coming here for? At whose cost? Did the federal government discuss with our doctors before even inviting the Chinese doctors? They should respect NMA. I'm even surprised that NMA is not even among the task force team or whatever. I thank Chinese for
okay, Ada, I'm so sorry to interrupt you, but I've got to interrupt you because we hear that the finance minister is also briefing on COVID-19. Let's find out what his perspective is.
The Group General Manager of the NMPC. Following the setting up of this committee, the committee was mandated to recommend fiscal measures to Mr. President for his consideration and approval. In this regard, the committee clearly recognized that Nigeria is currently facing significant fiscal risks due to the current global economic disruption caused by COVID-19 crisis, but also further aggravated by the decline in crude oil price, which has spiked our risk in the global financial market. Although similar challenges were experienced in 2008 and 2009, as well as in 2015 and 2016, Nigeria now has considerably lower fiscal buffers than in those previous economic downturns. The decline in international crude oil prices and domestic production may be magnified if a severe outbreak of COVID-19 occurs. Despite ongoing efforts to curtail the spread of the pandemic through compulsory lockdown of Lagos, Ogun, and the FCT, we still have to be very mindful that this can be aggravated. To directly address these health and economic challenges, the President the following policy framework to ensure that Nigeria's healthcare system, fiscal position, and economy are sufficiently supported to weather these shocks. The stimulus package comprised, as indicated, as I will be discussing now, but I want to indicate there has been monetary measures by the Central Bank of Nigeria, a set of fiscal measures, and as the time goes on and the situation will be announced. So the President has approved the establishment of a 500 billion COVID-19 crisis intervention fund. The establishment of this fund and provide much needed cash resources from various special accounts already existing in the Federation, and this
the minister, apologies, I said him, but it's her, Hajia Zainab Ahmed, of course. But she still is briefing, but we're seeing if we can clear up the lines a bit, and we'll continue with her briefing. Or have we come away from the minister?
No, it's just a network.
Okay. you know, we'll, as I said, you'll be getting the full details in subsequent broadcasts and bulletins as we go along. And we welcome, and our apologies to Ada, who had called in from Jos and who was speaking at the moment that we had to cut away. But just what Ada was, the point Ada was making was that really, the point that Dr. Boyo had made, have they identified a void? They're not taking care of us. That is the point of view of NMA. So please call in and let's know all things COVID-19, in addition to the subject matter right now about whether or not it was a wise move to bring in those Chinese professionals. The other aspect, of course, is how well we're doing in preventive measures, social distancing, you know, and all those kind of things. Stay at home. In other areas, in other climes, leaders come on a daily basis, sometimes more than once a day, to thank and encourage the people to stay at home. But here we have a different setup.
Exactly.
You know, our environment is not exactly like theirs.
It's not like theirs.
And so that's a worry. That's a worry because unfortunately the virus is going to be the same as theirs.
It's one virus.
It's one virus. And, you know, there have been theories that have not been proved in any way, shape, or form that perhaps the tropical climate, touch wood, might be affecting the spread, or because they're pointing to the relatively low figures that we're getting out of Africa. Some are saying that it's because we're not testing as many people as we should. Some are saying that
one is even another issue entirely.
Another big one. But our numbers are low. Let me see. AUDU in Kaduna. Good morning, sir.
Yes. Good morning. How are you?
Very well, thank you.
Kuyori, I'm a first-time caller on your program.
Oh, we're delighted to have you, Barrister AUDU.
Kuyori, I think you people, you are missing the whole point.
Okay, tell us.
Let me make this observation. The first thing is that you didn't bring a government, somebody from the government, so that we hear the other side of this, you know, what the government's position is.
We had a briefing, presidential task force briefing.
Kuyori, that is one angle to it. You should have brought somebody from the government so that this discussion can be balanced.
The presidential task force is government.
Okay. Now,
the Minister of Finance is government.
Let me say this.
Okay.
Now, the report I read in the paper is that some Chinese companies in Nigeria. Hello?
Yes, I can hear you.
That some Chinese companies operating in Nigeria have decided to assist the federal government with materials, and that they are sending in some experts too to support the government. It is not that the Nigerian government actually may ask the Chinese government to bring in these people.
No, the federal government reportedly has invited a medical team. That's what the reports are saying.
And that is what the minister said.
And that is what the minister,
you see,
you say we should bring government. That is what the minister, who you can't be more government than a minister, has said.
The report I read in the paper is that a group of Chinese companies working in Nigeria
let me
have decided to the federal government, and by way to do this, now send some materials, and then they are sending personnel.
Okay.
To assist. It is not for the Chinese government or any other person to bring in experts, as if, because the way the discussion is going, as if the government actually make this request. We didn't make that request.
Okay, thank you very much. Barrister AUDU, we've got to let go of you now. We've completely run out of time, but we're so delighted that you could put your point across, and we appreciate you for, calling in with it.
Yes, the thing is, if the minister had said that it is some Chinese companies in Nigeria that are actually giving that support or that assistance, I'm not sure it is going to make headlines. It's not going to be an issue. Because the minister categorically, the way it sounded was that it's the federal government that is bringing these Chinese. So if it were to be the Chinese companies saying that they wanted to assist, the minister would have broken it down. Then from there, we say, okay, fine. And we are still going to look at what the assistance they are going to give.
Well, thank
so
you
that
very
they
much.
will now maybe meet with the Nigerian Medical Association and so on.
We got to go. And thank you very much, Barrister AUDU. We couldn't finish with you, but maybe you can call in tomorrow. We could continue this, as we are going to leave you now with the Minister of Finance and her briefing, Hajia Zainab Ahmed.